And good afternoon. Welcome to Life Unrehearsed. My name is Matt Delvecchio, specializing in life transitions, downsizing, in the senior living industry.
And I'm Corrie Rouillard, a clinical social worker and psychotherapist specializing in grief and loss.
Coming right up on the first half of today's show, the latest treatments for menopause. Corrie, we posted this on our Life Unrehearsed Facebook page this week, and the reaction really has been incredible. Lots of interest. And I tell you what, spouses and partners, you're going to want to listen up as well, because we'll be addressing the challenges that women and couples face with menopause. That's coming up next. But first, Corrie, I have to give you kudos. You rock star. Montreal Gazette this week, Thursday, not like on page 3 or 4, not in the life section or the you section, front cover of the Montreal Gazette for your wonderful cause. Can you tell us a little bit about it? And congratulations. This was something
Thank you. It was very exciting. Some of you, our listeners, might remember that I spoke about that this month is Children's Grief Awareness Month, and November 18th on Thursday was Children's Grief Awareness Day. And in recognition of that, we were able for the first time ever to get the Olympic Stadium to light up in blue, which is the official color of the Children's Grief Awareness, to signify Children's Grief Awareness. Yeah. So we went out there. We were very excited. We gave out blue glow sticks. We got some hot chocolate from Rideau Funeral Home, which is a wonderful supporter of ours. And a lot of our families came by just to take pictures with us. I'm going to post a picture on the Life Unrehearsed page, because it was unbelievable, and so grateful that we're putting it on the community's agenda.
Well, no, it's something else. And I know Bill Brownstein did a fantastic article, and you didn't know that you were going to be on the front cover.
No, I did not.
We opened up the Gazette Friday morning, and look at that. Way to go, Corrie. I also want to give a quick shout out to the Prostate Cancer Support Group for Montreal and West Island. There's a discussion on prostate cancer and how precision nutrition can help. That's going to be this Thursday, November 25th at 7:30 via Zoom. Thursday on the 25th at 7:30. So you could register on the Prostate Cancer Support Group for Montreal and West Island website. All right, Corrie, what do we have coming up on the second half?
Coming up on the second half, we are going to be talking about some eye-opening trends in senior living industry. The stars apparently seem to be aligning as there's an increase in demand from the public for transitioning into senior communities, along with retirement homes offering these spectacular incentives. So who better than Matt Delvecchio to help us discuss and understand these trends and how we can best benefit from them? All that and more, and we will be taking phone calls. All that and more, that's coming up after the 3:30 CTV News. Yeah,
looking forward to that. And yes, we'll be taking in callers and texts after the 3:30. Any questions you have about the senior living industry, retirement homes, seniors residences, we'll be addressing them. All right. Menopause is such a hot topic. You catch that one, Corrie?
It makes me laugh listening to you talk about it. But go ahead, continue.
Yeah, that's
Carry on.
Bad. I'm sorry. I couldn't resist. Well, as mentioned, on that Facebook page, talking to friends even, and a lot of people are waiting to listen about what is the latest and greatest. So we decided to bring in an expert on women's health. Dr. Elise Rouillard is a licensed GP working at Clinique Médicale Privée Unimed alongside Dr. Evelyn Pung, and her practice focuses mainly on women's health and hormonal therapy. So blessed to have Dr. Rouillard. Welcome to Life Unrehearsed.
Thank you for having me.
Well, thank you for coming on. I know it's been a while that we've tried to get you on. I know we've waited because you have the latest updates from some research that's recently been published. But first, let's back it up a bit, Dr. Rouillard. And when does menopause typically occur, and for how long?
Well, first of all, we have to know that menopause is a natural phenomenon, and it occurs around the age of 51-year-old. Otherwise, women may experience it earlier or later, let's say around age 45 up to 56, 57-year-olds, depending on your genetics and other factors. If we stick to the definition of menopause, it is really the date where it's for 365 days that you didn't have any period. So it's typically one day, and after that, it's postmenopause that kicks in until the end of your life, basically. So this is it. So it lasts forever, and it's the before that's interesting.
Well, you're talking to someone who's in their 50s and like, I am the one. No, who's kidding? I'm the one who's been waiting for this interview. Let's talk about the symptoms, the ones I'm experiencing and others may be experiencing. What are some of the symptoms? What are some of the more typical symptoms?
Yes, when we talk about menopause, people think, oh, I have hot flashes, I'm in menopause. But it goes beyond, and the symptoms occur several years prior to menopause. And the most common one is really insomnia. It arrives earlier in the late 30s, beginning of 40s, and then anxiety starts kicking in. It comes often from nowhere, and sometimes the PMS symptoms seems to be more increased. There is cramping, breast tenderness, digestive issues like bloating. Some women will experience even memory loss, and they lack a bit of focus in their daily jobs. They will have some night sweats. Some will have some palpitations. The level of energy will somehow go lower with no reason. There's even vaginal dryness, some weight gain, and a lot of other symptoms that can be really bothersome for some women. Some will experience none of these. Some will have all of them. So it's really very different for each woman. But the symptoms are there and can be very bothersome. That's why we're there to address them.
You're listening to Life Unrehearsed with Matt and Corrie, and that's Dr. Rouillard. She's a women's health specialist, and we're talking about menopause, and we're soon going to be talking about some of the treatments as well. But first, Dr. Rouillard, I hear sometimes they get mixed up. I hear premenopause, perimenopause. Is it the same thing? Is there a difference?
Actually, it's not the same thing, okay? They think that menopause is when you have no more periods for a period of 1 year. Perimenopause is the period of 1 to 3 years before the menopause. So in this perimenopause time frame, we see really irregular cycles. You can skip 1 month, 2 months, then have periods twice in the month. It's very, very irregular. And before this perimenopause period, we call it the premenopause. It's everything that comes before. And somehow during this time frame, it can last many years. You will have little differences in your cycle. They're a bit irregular, but not that much. It will tend to shorten a little bit, maybe get heavier. But there isn't a lot of changes in the cycle. It's more in the other symptoms, like we discussed, insomnia, anxiety, loss of concentration. The memory is not as good as before. And these start to show really during the premenopause stage.
Okay, so let's talk about nitty-gritty. I want to discuss more of the methods and the strategies that you know of in your research and your practice that help us deal with menopause. Perhaps we can start with hormone therapy?
Yes, hormone therapy. The idea behind hormone therapy is really to balance the hormones that are slowly decreasing in our body. The ovaries produce estrogen and progesterone all our life as we get our period. And then when we get menopausal or close to menopause, the hormone starts to drop. And the idea is to supplement your body with those hormones that you no longer make naturally in the enough quantity to feel good. And in order to optimize the bodily function, we supplement the hormones such as estrogen and progesterone. They are important for the bone formation, the cardiovascular system. They have an impact on the cognitive function as well and other bodily function. Overall, it is shown that giving hormone therapy increases the life quality and overall health of women.
It's Dr. Elise Rouillard, and we're talking about menopause and now specifically to treatments and even narrowing it down to hormone therapy. And Dr. Rouillard, you know a lot about this. So what are some of the ways to administer hormone therapy?
Well, there are several ways to give it. Estrogen is mainly given either orally or transdermic, which means through the skin. We can either apply a patch or use a gel that you're going to apply daily. And the progesterone part is given orally mainly because there's a better absorption, and the progesterone has some effects as well on the brain, and it helps for anxiety and sleeping problems. There's also vaginal treatments that can be used for vaginal dryness that can be inserted vaginally. and other creams or tablets can be inserted as well. So there's different means to use the estrogen and progesterone, and every woman has a different recipe. Some women will use a patch and a gel. Some women will use only a patch. Some will prefer a gel. It's really depending on each woman's need, and we tailor the treatment accordingly to their needs.
Just quickly, what's the time frame when someone might want to start or need to start the hormone therapy?
Well, the latest guidelines say that it's optimal to start within the 10 years of your menopause in order to really benefit for the protective effects of the estrogen and progesterone, and also because the women are very healthy during this time of their life. And this is really the optimal time frame. We can start a bit later if the person is in good health, doesn't have any contraindication, and has a particular problem that she wants to address, like the hot flashes or vaginal dryness or urinary tract infections that are coming repetitively. This can also be addressed by hormone therapy. We also start earlier than the menopause, obviously, because women through the premenopause experience disturbing symptoms as well. So, but otherwise, from the premenopause to the 10 years of menopause, it's really safe to start hormone therapy.
All right. And from what I understand, Dr. Rouillard, lifestyle can have a significant impact concerning menopause. But first, we need to head out to traffic. But when we come back, we're going to ask you about how lifestyle can affect menopause.
Welcome back. You are listening to Life on Rehearse. I'm Corrie Sirota, and yeah, I'm on fire. I'm along with my co-host, Matt Del Vecchio, and we are talking about some of the latest trends for menopause with women's health specialist, Dr. Elise Rouillard. Dr. Rouillard. Hello. Dr. Rouillard, I understand that lifestyle can have a significant impact concerning menopause. Why is that?
Well, it's important that you have a healthy lifestyle, you have a good diet, you exercise, and you minimize the consumption of alcohol because it can increase your insomnia and it can increase your hot flashes at the same time. On top of that, smoking can also increase your cardiovascular risk, which are more increased as you get older. And when you go through the transition of menopause, you're not as protected on the cardiovascular side because your hormone levels are going down. It's also important to have a good work-life balance and to manage your stress because it's all part of having a healthy lifestyle to protect yourself in other ways. So hormone is important, but overall having a good lifestyle is really important. And we see a lot of women that are unfortunately self-medicating with drugs or alcohol lately because they're lost or they have some depressive moods. So it's important to address this as well when we do look at the overall health of women in menopause and premenopausal states.
So, Dr. Rouillard, you talked about hormonal therapy, obviously one very important way to deal with menopause. So what other methods and strategies are there to deal with menopause?
For women that don't want to go towards hormone therapy, there is other medicines such as antidepressants that can help to stabilize the mood and reduce a little bit the hot flashes. It can also help for anxiety. You can have also some sleeping aids like pills. For the aches and pains of menopause, there's also some painkillers that you can take. Acupuncture as well is helpful for hot flashes and can help to reduce some pain. Obviously, meditation is very popular, exercising. There are also some natural products out there that can be helpful, but unfortunately, and none of these other products are as good as estrogen. Ultimately, our body produces estrogen, and we need to replace it by estrogen in order to optimize our function and our life quality. But for women that cannot take these, other options are available and can be helpful as well.
Mm-hmm.
It's so incredibly interesting what you're saying. I have a question, and this is very important, Dr. Rouillard. How does menopause affect the libido? Remember, my husband is listening.
It affects the libido because we have a drop in our hormones. We lose estrogen, progesterone, but we also lose testosterone, and our cortisol levels increase and have all kinds of effects on our overall hormones. It can affect our libido because we will gain a bit of weight, we will have some maybe self-confidence issues, we may be a bit more tired and not really into the mood. So it has all type of effects, and it's not only a physical part libido, it's also a psychological part of it, and it's very important that you have to be in the mood, in the right psychological mood, but your body has to also follow, and sometimes we don't have all of these at the same time.
It's Dr. Elise Rouillard here on Life Unrehearsed, and we're talking about menopause and treatments. And Dr. Rouillard is a women's health specialist, and appreciate your input here. We're going to bring the guys into this, Dr. Rouillard. So how can a spouse or a partner support someone going through menopause?
Well, actually, it's funny because usually the spouse is really looking at us from a different point of view, because the woman stuck in her premenopause, menopause state doesn't see herself. She doesn't realize that she maybe having patterns where she's not happy or she's stressed and she's not sleeping. And the spouse may see, oh, I think my wife is having this pattern coming, or their period are coming, or she is all over the place, and you are really there to see there's something wrong. Or if you see also that your partner is having some weird habits, or is self-medicating, or drinking more, or seems to be unhappy or stressed out, it's important that you just listen to the person, and if you're concerned, you raise this issue with the person, because when you're stuck in it, not necessarily you're going to feel it, and you're going to realize that something's wrong. So you have to be patient, and if you are worried, just raise the question with your partner. It's important that you get the proper treatment. There's hormone, but there's other issues that can be assessed as well.
Mm-hmm.
I was kind of hoping you were going to say they should go out and buy them lots of gifts and give them back massages. And, that was kind of, but that's what I was going for. But thank you. No, it's all what you said is terrific. Let's talk about why it's important to get a proper assessment done.
Well, it is important, and I, as a GP, I find that it's really important to get a full history of my patient, to do a full physical, to do the proper blood test, and to really look into the other diagnostic that can be having the same symptoms as menopausal symptoms or premenopausal symptoms, because being tired is a very common symptom. So you need to make sure there's no underlying medical issue that needs to be treated prior to start any hormone therapy. And we need to understand that we're not only a physical body, but there's also a psychological part in it, and it needs to be assessed as well. So the psychological issues, the physical issues are really important to be looked at and cared for. And you can have insomnia because you're lacking hormones, but you can also have insomnia because you have sleep apnea. And you can be depressed because you have sleep apnea. So that's where the GP can try to piece all the pieces of the puzzle to remake the puzzle and help you at its best and make the best choices with you.
Dr. Rouillard, that's really where you come into play as a women's health specialist, because it's not just physical. You take into the whole psychology of it, and assessments are so important, and this really is your specialty. So we want to thank you very much for coming on Life Unrehearsed and sharing your thoughts with us. How can our listeners reach you?
Well, they can reach me at Clinique Médicale Privée Unimed. We're located in Montreal, Ville-Saint-Laurent. And they can send us an email at info@uni-med.ca, or they can call us for an appointment at 514-303-8303, and we'll be happy to help them out and fix an appointment if they want to look into their symptoms with us.
Wonderful. Well, Dr. Rouillard, thank you very much.
My pleasure. Thanks for having me.
All right. Thank you. That's Dr. Elise Rouillard, women's healthcare specialist working out of the Uni-Med Medical Clinic. That's Uni-UNI-MED. All right, Corrie, what do we have coming up on Life Unrehearsed?
Coming up, we will be talking about some eye-opening trends in the senior living industry. The stars clearly seem to be aligning. There's been an increase in demand from the public for transitioning into senior communities, along with retirement homes offering very spectacular incentives, which is why we have Matt Delvecchio here, who's going to help us discuss these trends and how you can benefit from them. That's all coming up after the 3:30 CTV News.